Infertility. Infertility affects millions of people and has an impact on their families and communities. Estimates suggest that approximately 1 in every 6 people of reproductive age worldwide experience infertility in their lifetime. In the male reproductive system, infertility is most commonly caused by problems in the ejection of semen, absence, or low levels of sperm, or abnormal shape, morphology, and movement, motility, of the sperm. In the female reproductive system, infertility may be caused by a range of abnormalities of the ovaries, uterus, fallopian tubes, and the endocrine system, among others. Infertility can be primary or secondary. Primary infertility is when a pregnancy has never been achieved by a person, and secondary infertility is when at least one prior pregnancy has been achieved. Fertility care encompasses the prevention, diagnosis, and treatment of infertility. Equal and equitable access to fertility care remains a challenge in most countries, particularly in low and middle-income countries. Fertility care is rarely prioritized in national universal health coverage benefit packages. Overview. Infertility is a disease of the male or female reproductive system, defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility may occur due to male, female, or unexplained factors. Some causes of infertility are preventable. Treatment of infertility often involves in vitro fertilization, IVF, and other types of medically assisted reproduction. What causes infertility? In the female reproductive system, infertility may be caused by tubal disorders such as blocked fallopian tubes, which are in turn caused by untreated sexually transmitted infections, STI, or complications of unsafe abortion, postpartum sepsis, or abdominal and pelvic surgery. Uterine disorders, which could be inflammatory in nature, such as endometriosis, congenital in nature, such as septate uterus, or benign in nature, such as fibroids. Disorders of the ovaries, such as polycystic ovarian syndrome, and other follicular disorders. Disorders of the endocrine system causing imbalances of reproductive hormones. In the male reproductive system, infertility may be caused by obstruction of the reproductive tract, causing dysfunctionalities in the ejection of semen. This blockage can occur in the tubes that carry semen, such as ejaculatory ducts and seminal vesicles. Blockages are commonly due to injuries or infections of the genital tract. Hormonal disorders, leading to abnormalities in hormones produced by the pituitary gland, hypothalamus, and testicles. Hormones, such as testosterone, regulate sperm production. Example of disorders that result in hormonal imbalance include pituitary or testicular cancers. Testicular failure to produce sperm, for example due to varicocele, or medical treatments that impair sperm-producing cells, such as chemotherapy. Abnormal sperm function and quality. Conditions or situations that cause abnormal shape, morphology, and movement, motility, of the sperm negatively affect fertility. For example, the use of anabolic steroids can cause abnormal semen parameters such as sperm count and shape. Lifestyle factors such as smoking, excessive alcohol intake, and obesity can affect fertility. In addition, exposure to environmental pollutants and toxins can be directly toxic to gametes, eggs and sperm, resulting in their decreased numbers and poor quality. Why addressing infertility is important. Every human being has a right to the enjoyment of the highest attainable standard of physical and mental health. Individuals and couples have the right to decide the number, timing, and spacing of their children. Infertility can negate the realization of these essential human rights. Treatment. Infertility treatment depends on the cause of the infertility, how long you've been infertile, your age and your partner's age if you have a partner, personal preferences. Some causes of infertility can't be corrected. If pregnancy doesn't happen after a year of unprotected sex, couples often can still become pregnant through infertility treatments called assisted reproductive technology, ART. But treatment can involve big financial, physical, emotional, and time commitments. Treatment for men. Men's treatment for general sexual problems or a lack of healthy sperm may include lifestyle changes. Your healthcare team may recommend that you take the following steps. Have sex more often and closer to the time of ovulation. Get regular exercise. Drink less alcohol or give up harmful substances such as tobacco. Stop taking medicines that can affect fertility, but only if your healthcare team tells you to. Medicines. Your team may prescribe medicines to improve sperm count and boost the chances of a successful pregnancy. These prescription drugs may help the testicles function better too. Surgery. Sometimes, surgery may be able to reverse a sperm blockage and restore fertility. In other cases, repairing a large varicocele may improve the overall chances for pregnancy. Sperm retrieval procedures. These techniques can collect sperm if you can't ejaculate, or if no sperm is in your semen. Sperm retrieval procedures also may be used when assisted reproductive techniques are planned and sperm counts are low or irregular. Treatment for women. Some women need only 1 or 2 treatments to improve fertility. Others may need a few types of therapies to become pregnant. Fertility medicines. These are the main treatments for infertility that's due to ovulation trouble. They can help the ovaries release an egg if ovulation is irregular or stops happening. Talk with your healthcare team about your options. Ask about the benefits and risks of each type of fertility medicine. Intrauterine insemination, IUI. With IUI, healthy sperm are placed directly in the uterus around the time that the ovary releases 1 or more eggs to be fertilized. Depending on the reasons for infertility, IUI can be timed with your menstrual cycle or with the use of fertility medicines. Your partner or a donor provides the sperm. Surgery to restore fertility. Some conditions of the uterus can be treated with hysteroscopy. These include polyps, scar tissue, and some fibroids. Laparoscopic surgery with small cuts, or traditional surgery with a large cut in the stomach area, may be needed to treat conditions such as endometriosis, pelvic adhesions, and larger fibroids. Assisted reproductive technology, ART, is any fertility treatment in which the egg and sperm are handled. In vitro fertilization, IVF, is the most common ART technique. Some of the key steps in a cycle of IVF include: fertility medicines are used to help the ovaries make eggs. Mature eggs are removed from the ovaries. The eggs are fertilized with sperm in a dish in a lab. The fertilized eggs, also called embryos, are placed in the uterus. Embryos also can be frozen for future use. Sometimes, other techniques are used in an IVF cycle, such as intracytoplasmic sperm injection, ICSI. A single healthy sperm is injected directly into a mature egg. Often, ICSI is used when semen quality or quantity is poor. Or it might be used if fertilization attempts during prior IVF cycles didn't work. Assisted hatching. This technique helps an embryo attach to the lining of the uterus. It opens part of the outer covering of the embryo, which is why it's called hatching. Donor eggs or sperm. Often ART is done using a couple's own eggs and sperm, but you have the choice to use eggs or sperm from a donor. This is an option if you're single or in a same-sex relationship. It's also done for medical reasons. These include poor egg quality due to age and sperm problems such as a blockage in the reproductive tract. Donor eggs or sperm also might be used if one partner has a genetic disease that could be passed on to a baby. An infertile couple can use donated embryos too. These come from other couples who received infertility treatment and had leftover embryos that were frozen. Gestational carrier. people who don't have a working uterus, or for whom pregnancy poses a serious health risk, might choose IVF using a gestational carrier. In this case, the couple's embryo is placed in the uterus of a person who agrees to carry the pregnancy. Genetic testing. Embryos made with IVF can be tested for genetic problems. This is called pre-implantation genetic testing. Embryos that don't seem to have a gene problem can be placed in the uterus. This lowers the risk of a parent passing on a genetic condition to a child. Complications of treatment. Complications of infertility treatment may include multiple pregnancy. The most common complication of infertility treatment is a multiple pregnancy, twins, triplets, or more. A higher number of unborn babies in the womb raises the risk of premature labor and delivery. Ovarian hyperstimulation syndrome, OHSS. Fertility medicines can cause this condition in which the ovaries become swollen and painful. The risk of OHSS goes up with the use of assisted reproductive technologies such as in-vitro fertilization. Bleeding or infection. Assisted reproductive technology or reproductive surgery comes with a risk of bleeding or infection. WHO response. WHO recognizes that the provision of high-quality services for family planning, including fertility care services, is one of the core elements of reproductive health. Recognizing the importance and impact of infertility on people's quality of life and well-being, WHO is committed to addressing infertility and fertility care. This video is for informational purpose only and should not be used as replacement for expert medical advice. In this video, we delved into the topic of infertility, exploring its causes, treatments, and the emotional impact it had on individuals and couples. We provided a comprehensive overview of the different factors that contributed to infertility in both men and women, including lifestyle choices, medical conditions, and environmental influences. Additionally, we discussed various treatment options, from medication and surgery to assisted reproductive technologies like IVF. We would like to extend our heartfelt thanks to the World Health Organization, WHO, for allowing us to use their valuable information, which has been instrumental in creating this informative video. If you found this video helpful and informative, please don't forget to like, share, and subscribe to our channel, Knowledge and Entertainment. Your support helps us continue to create content that educates and entertains. Thank you for watching.